Get 6 months of local news for just $2. You get unlimited access to the news and information you need to stay connected to your community. Visit inforum.com/subscribe to get 6 months of local news for just $2.
You're listening to Plain Talk, the voice of North Dakota politics. I'm your host, Rob Port. If I sound distracted, it's because I've been busy covering this story all morning. I'm joined by my co-host, Chad Oban.
He's right of center, I'm left of center, both sides of the political spectrum.
I think it's cathartic. I think it's a necessary and proper debate. I'm glad we're having it.
And honestly, we have to do better.
Okay, I don't know why I'm getting blamed for this, right? Chad, I gotta say I am dismayed because this morning I opened up my Spotify app to put on some music as I was working through my morning, and it notified me that my Spotify Wrapped was available, and that's always fun, right? To kind of look at how much music you listen to and who you listen to over the course of a year. And the first thing it tells me is my Spotify age is 72 years old. Yeah. 72. Can you believe it?
No, yes, I can believe it, but I think more importantly, I dug a little deeper into your numbers when you posted on Facebook, and I got to tell you, I was super impressed that John Prine was your number 2 artist. I listened to John Prine. It's interesting. I didn't get into John Prine until after he died, though.
Really?
I wasn't that familiar. But your number 3 artist was Cake.
I think it was number 5, actually.
Whatever.
Yeah.
It's number 3 in my head. But
I don't know what you've got against Cake.
I don't have anything against Cake. I just can't imagine with all the different music that could be in your top 5 that the band that brought you that Long Jacket song is in your top 5. So I'm so impressed with John Prine and so disappointed. Cake was number 4. We were both
number 4,
okay,
right behind Warren Zevon.
All your other 4 are great, and then Cake doesn't belong in there.
They got some songs I like, man. I don't know what to tell you. I'm bearing my soul about my musical tastes online. I am upset about 72, but what are you gonna do?
I would have guessed 70.
All right. I'm the one who always makes fun of you for being old.
Yeah, I mean, in all honesty, for all the crap you've given me for being the old guy on this show. By the way, I was taking a selfie the other day with a group of people, and I was like a 90-year-old trying to take a selfie and try to and it's the first time it really hit me that I was trying
to. My wife and I were trying to take a picture of the family in front of the Christmas tree. We wanted to make sure everybody was in, so I was trying to use the AI thing on my Pixel phone where you take a picture and then you swap with somebody and you stay, and then it'll stitch the 2 photos together so everybody's in the photo. Kind of neat. My wife and I could not figure this out. It took us 20 minutes. I felt I was having flashbacks to when my dad couldn't program the VCR and I had to step in, which that also probably dates me that I remember when VCRs were a thing. Anyway, hey, our guest is rolling her eyes and wondering why the hell she's party to this conversation.
She's agreeing with her eyes that Cake is terrible.
Cake is not terrible.
Cake just did a tour, and my husband and kiddos went and saw Cake. I think they came to Sioux Falls, but they saw them in Mankato. So I love the what's the bucket seat song, the stick shifts, and
yeah, that's a great song. I play that for my wife all the time. I played it for my wife. When I was in high school, my first car was a truck. They had a bench seat in the front, right? Which was great because when I was driving a girl around, I'd be like, hey, you should sit in the middle.
Snuggle
up.
It's
a song about that. It's a great song, Chad. Don't shake your head. It's a wonderful, wonderful song. Hey, by the way, the voice you're hearing is Shelly Ten.
Up in your pickup truck is what I'm struggling with here.
All right. Well, the voice you're hearing, that's Shelly Ten Napel. She is the head of Community Healthcare Association of the Dakotas, so North and South Dakota. And she came on because we've been talking a lot about healthcare. And why wouldn't we be talking about healthcare? Back in August, North Dakota Insurance Commissioner John Godfread came on this show and said Congress has got to renew these subsidies for the ACA exchanges, Obamacare exchanges, whatever you want to call them, that we got to renew them, or Americans, North Dakotans, are going to get whammied with some massive premium increases. There's tens of thousands of North Dakotans. I'm sure that story is the same down in South Dakota, probably more because they've got a bigger population than we do. Here we are in December, and it's still not done. And at the time, our insurance commissioner warned, they can't just wait till the end of the year. They need to do it now. Well, we're at the end of the year. It's practically 2026, and this still isn't done. And so I'm here to talk with Shelly wanted to come on. She asked to come on the show to talk a little bit about this because, Shelly, I'm looking at this. This has got to be a hardship. I mean, there's a lot of North Dakotans, a lot of South Dakotans who are thinking about, they want to buy things for Christmas. They want to maybe take a holiday trip. They're thinking, of course, after the New Year's always can be kind of a rough financial time for a lot of people. And now they're thinking, my health insurance premium might go up, what, 20%, 30%? Do we have an idea of what the increases would look like if Congress continues to do nothing?
Yeah, absolutely. And thank you guys for having me. I was shared earlier, but I've loved the conversation.
And by the way, thank you for stepping in and defending me on my musical taste from chat. That was very much appreciated. You're welcome
No
on the show
problem.
anytime.
I think Spotify thinks I have the taste of a 10-year-old boy because I'm always playing my son's music, and my husband won't do it. He's like, I don't want to mess up my algorithm. So it's always me that has to play his songs. And so I'm worried what my rap is.
I did have a Spotify rap where the soundtrack for Moana was my number
Yeah,
one. And that was
I
because my kid, every time we got in the car, my kids had to have it.
Yes, absolutely. So let me just, for those who aren't knee deep into what the marketplace is versus what, all the other ways people can get coverage, let me just back up a tiny bit and just remind folks that the marketplace is a place where people can buy individual and family coverage. And it's really focused for people who aren't offered employer-sponsored coverage. So that's your farmers and ranchers, that's your small business owners, that's your gig workers, and those who just work for employers who can't afford to offer health coverage. So it's about a little over 40,000 people in North Dakota who buy their coverage there. And it was created to really be a marketplace. And I'd love to just share a little bit more, if you're interested, about kind of why it was developed and the problems it was trying to solve. But in this moment in time, we're kind of looking, so over the last 4-ish years, there have been enhanced premium tax credits in the marketplace. So when the marketplace was designed, it was always created that there would be quite a bit of federal help for people to afford insurance on the marketplace, which is only fair because, there's a lot of tax breaks on the employer side too. So those individuals, farmers, ranchers, et cetera, weren't getting that same help as everybody else was getting. So there's it was always designed to kind of help you afford coverage. It's pegged to your income. So 133 up to 140 or 400% of poverty, you have to put a certain percent of your income towards coverage. So when you ask the impact, it gets a little challenging because the cost is impacted one by age. So coverage is more expensive if you're older, which makes sense. It's impacted by your income and then your family size. So all of those things come into play. And I have a little example if it would help kind of walk through what those impacts could be for individual people. But that's what's at stake, these enhanced tax credits, and they are going to have a big impact on family budgets for sure.
Shelly, the conversation happening in Washington, and I mean, healthcare, health insurance is very complicated. It's a very complicated policy, but it feels like right now that the folks who are not interested in extending the enhanced subsidy are basically saying this won't fix health insurance, so therefore we shouldn't do it. And this was only supposed to be a short-term thing. And the conversations we've had on the show with the insurance commissioner and others is this is sort of it helps us bridge to a time where we can do something bigger on health insurance and what the providers are charging people and what insurance companies are charging and whatever. But it doesn't feel like we're having a real conversation because we're still dealing with the concept of a plan from the White House. There's no actual plan to fix this thing. So are you saying the subsidy will solve the problem? I assume not. What then? Like, what else can be done in the marketplace? You brought up farmers and ranchers. Farmers and ranchers are hurting a lot of other places, not just health insurance. And it's scary for places like North and South Dakota. So the subsidy gets put back on, then what?
Yeah, so it is kind of two separate things. The overall cost of healthcare in the United States, which to say it's 18% of our GDP, that's way higher than many, many other countries who cover everybody. So they're all at like 10 to 12 and we're at 18. So you're right to identify cost as being a big issue. In this moment, though, what we're looking at is just if the federal government shifts costs onto individuals and families, that's not really saving money. It's just
Right.
shifting who's paying the bill.
So let's talk a little bit. I mean, do you have some examples of the sort of monthly or annual increases that, I mean, let's put a number to it, because we're kind of talking in the abstract. It's not a $30 a month increase, I'm assuming. Can you put some numbers to that?
Yeah, absolutely. So what I did is I kind of went out and looked at what's the median income in North Dakota. So for those, middle school math, median is like that middle, so 50% below, 50% above. And that number in North Dakota is 88,000 household income. So let's just assume you're a family of four, two adults, two kids, who is trying to buy health coverage on the marketplace. So with enhanced premium tax credits, you would need to pay 4.95% of your income. And that's pegged to a benchmark plan. So if you want to pay more or want to pay less, you can choose different types of plans, but just kind of to keep it at the benchmark. So like with the enhanced tax credits, you'd pay 4.95% of your income. That'd be $363 a month or $4,300 a year. So without the enhanced premium tax credits, your percent goes up to 9.16 for that family of four, which is $672 a month. So it's more than double, 363 to 672, and your annual for the year would be over $8,000. So that kind of gives you a little bit of a sense of kind of the impact on family budgets that losing this enhanced tax credit.
$8,000 a year. Yeah, I mean, you tell me how many families can afford another $8,000 a year out of the blue.
And Shelly, what kind of plan are we talking about there? I mean, because I've heard stories of people looking at the market that are deciding they can't afford it because it's a bronze plan and the deductible is $24,000 a year. And so those people are trying. So when that scenario where it goes up to, an $8,000, what kind of plan is that?
Yeah, that's a silver level plan. So the way the marketplace is designed is it's actuarial value, and then you can get bronze, silver, gold, platinum in some places. And so it is pegged to a silver level plan, which covers 70% of your costs from an actuarial value. So that's not everything, for sure. There's still going to be out-of-pocket costs for individuals. And maybe just to share too, like if you had to buy that coverage off the shelf, it'd be about $20,000 a year. So paying $8,000, you're still getting quite a bit of discount. And for those individuals who are above 400% of poverty, so if that family of four made $130,000, now there's no subsidy whatsoever for them. So that's another big thing that's going away. So with the enhanced subsidies, no one was going to pay more than 8.5% of their income. So even if you're older and have a more expensive plan or whatever it is, a bigger family, you're not going to pay more than 8.5% of your household income. And that part is going away now too. So those families, earning 130 and above, if they have four people in their family, are going to have to pay full freight. And that's going to be a huge hit for sure.
Let's talk a little bit about the cost. And then I kind of want, because I look at things in Washington, D.C., and I feel like things are helpless. So then I kind of want to get into what it's kind of where my mind at is how states like North Dakota can prepare ourselves for continued federal dysfunction. But talk a little bit, because the rebuttal to this I hear, and I think it's a fair point, is we are a country that is running an annual budget deficit of about $2 trillion. These subsidies are very, very expensive. So and growing as more people are joining these plans. So what do you tell what's the rebuttal to saying, listen, we can't renew these because we don't have the money as a nation?
Yeah, I mean, these individual families don't have the power to change the cost trajectory of healthcare system, they themselves. So there are some bigger picture things I think we can do to contain cost. That's not going to be driven by Sally and her two kids trying to get healthcare. So I think there's a conversation about containing costs. Happy to go there. But shifting costs is not the answer.
Yeah, I want to. What happens when that family's on the marketplace and sees these increases and makes that determination that they're just not going to get health insurance? I see in some of your website that 40% of community healthcare patients are Medicaid patients. I think that there's a desire in Washington to cut Medicaid, certainly the Medicaid expansion part of it. I think there's some desire in North Dakota to not continue Medicaid expansion. What does it mean for my health insurance rates as an individual and an employer if we have a mass exodus of people not having health insurance? Because there is that trickle down effect of when people can't afford to get health insurance.
Yeah, for sure. So the two easy answers is one, what we would expect is that probably healthy people will be the first people to drop coverage. So those younger individuals, those people without current chronic conditions. And the great thing about having them in the market is that they're paying towards the pool, they're making the risk pool healthier. So when health plans knew that they had to submit rates for a lower premium tax credit, those rates were higher because they were already thinking, okay, a bunch of healthy people are going to drop out of the market, our risk pool is going to get sicker, and so the costs are going to go up for everybody. So for those individuals who don't get the premium tax credit, they're going to feel the crunch of that. So that's a piece of it. And then, of course, we represent healthcare providers across rural and urban communities. And when that coverage levels go down, that's more people who aren't able to pay for care, who are turning up, at a later stage of health conditions, that kind of thing at the hospital. So it certainly has an impact across the system for sure.
So what do we do? I mean, I agree. I just asked you the question about the cost. I don't think we have the money. I also don't think we have a choice but to do this. We've put ourselves in this position through a lot of foolishness. I think the marketplaces are probably are a good idea in theory, but we've got to get a way for them to function in a self-sustaining way where the taxpayers don't have to subsidize them. So what do we do? I mean, I think we ought to continue the subsidies, but have that be part of a larger package towards a reform that can tamp down. So what can we do at the national level? Although I have little hope for them doing anything productive. What can we do at the national level? And maybe more importantly, what can we do at the state level to get our arms around this?
Yeah, for sure. So a couple of thoughts I have, and I really focused on the state level because I think that really is, the more immediate opportunity with a lot of kind of dysfunction happening at the federal level, unfortunately. Now, these are big bills, so at the end of the day, we need a federal solution, but I do think there's lots of really interesting things states are doing across the country. So none of these ideas are new or unique or whatever. They're things that other states have been trying and doing. But one of the things I think would be really valuable is investing further upstream. So thinking more about investing resources in primary care and prevention. So I think one of the reasons our healthcare costs are so high is because that's really what we incentivize in the way we pay. We pay way more for those high cost, high technical surgeries and all of those things at the high end of the healthcare system, but we completely underinvest in primary care and in preventive services. So just to give you a sense, there was a study a few years ago of Medicaid programs, 13 different Medicaid programs across the country. And what they found is that individuals who are served by a health center who get their primary care at a place that's doing holistic primary care, that's not focused into a system and just kind of trying to kick people into specialty visits, but really is investing in that primary care that that individual needs, that the total cost of care for those individuals was 24% lower. So and we see that across international. So in other countries that spend a lot less on healthcare, they have double the investment in primary care that we have in the United
Well,
States.
I think it's probably true even for people who have their own insurance. I mean, I could tell you sometimes I don't go to the doctor probably when I should because I'm afraid of what the bill's going to be. I'm afraid of, and people who have high deductible plans outside the marketplace, I mean, they're thinking, God, the first 25,000 or 5,000 or 10, whatever their deductible is, I got to pay out of pocket anyway. I'm just not going to go to the doctor. I'm just going to wait till I get really sick and it's unavoidable. And at that point, the bill is huge.
Yeah, and we see that a lot. So if you have a diabetic patient, are we investing in helping them manage that condition, helping them understand that condition, helping them, prevent that kidney failure, the limb amputation, the dialysis? So it really is a stark trade-off as to whether we're gonna invest money front end or just kind of pay for it on the back end. Another just example that I think is an interesting one on the prevention side. Do you want to guess what the most prevalent chronic disease among children is?
Asthma.
It's a good guess. So it's tooth decay. So it's a super preventable condition. North Dakota did a study, and between 64 and 68% of third graders in North Dakota have tooth decay. And North Dakota also has some really great programs like sealant programs. If you put a sealant on a kid's teeth, you can go into the school, do sealants across the board, and that reduces their risk of tooth decay by 3 times. And I know for me, I grew up in a town that didn't fluorinate their water, and my mouth is full of cavities. And at this point, I am like in my 50s and I'm having chipped crowns, so all of the problems that have kind of resulted from, let's continue to fluorinate our water. Let's think about those things that we can do to prevent disease. This is just one example. So I'd love to see, kind of continued investment. And I think, at the federal level, sometimes we're seeing that disinvestment in public health and in prevention. But, I just think that's penny wise and pound foolish.
We could do a whole podcast about how we should better utilize our schools as a place to provide these basic services in community schools. But I want to shift gears a little bit to healthcare providers. You said you obviously represent healthcare providers, a little different healthcare providers than the big systems that often we talk about with the Sanfords and those kind of things. But I'm a firm believer that healthcare providers, health insurance companies, Republicans, Democrats, everybody in the whole system has to come to the table and care about what's going on with consumers and making people healthy. But we've expressed some frustration about lack of transparency from healthcare providers and how can the customer, I mean, we love to talk about free market, but I have no idea what it costs if I have to go down to the emergency room. I'm just going to go. So what can we do on the healthcare side in terms of transparency? I will tell you, some of the hospital folks that we've talked to don't want to do anything more in transparency. So how do community health centers feel about that? Maybe being a little more open about what they're charging, not consumers and insurance companies.
Yeah, absolutely. So for health centers, we do have to make our charges public, and we also see everybody regardless of ability to pay, and we see people on a sliding scale. So if you have a lower income, we take a look at that and we have a process for reducing what you have to pay. So that's kind of one piece of it from the health center side. We also, all of our quality metrics are public as well, and we report those federally and they're publicly available online. So we're ready to put our quality measures and our affordability up against anybody in a super public and transparent way. I will say one of the things that I have been a little interested in and excited about in the state's proposal about in the Rural Health Transformation Fund is they're talking about an all-payer claims database. So and I know you guys have talked about this, but there's kind of three things happening in charges. One is the super high charge that you're seeing, like at hospitals or other places that almost no one pays except if you're uninsured, which is unfortunate. Then you have your commercial rates, which are negotiated. And then you have below that your Medicare and Medicaid rates that are set based on the complexity of that condition, and they're kind of more nationalized, at least on the Medicare side. So as a consumer, you're kind of navigating all of that. Plus, you're wondering, what's my copayment? Like, I don't really care what the charge is. I want to know what I have to pay today. And so that's all of that goes into, understanding pricing. But what an all-payer claims database would let us know is like, what was the actual amount paid for each of these services, if people are covered by insurance. And so what states have used that data for is to understand, okay, why is this hospital system charging twice as much for the same, or getting paid, I guess is a way to say that, getting paid twice as much for the same service? And then what are the quality outcomes? Are they any better? And I think what states have seen, other states who've used this, as they've seen, they're charging twice as much, but the outcomes aren't any better. So it starts to help you trend healthcare costs over time. It helps you understand, what are the cost differentials, and it can help you identify where are like our cost problems. Like, what are those things that we can identify as real needs? I know for us as health centers, one of the things we really look at, so 50% of healthcare costs are incurred by 5% of people. So honing in on a good chunk of that 5%, I mean, some of them end of life, other things you're not going to change that trajectory, but honing in on those high need individuals and really supporting them with, how do we get their care coordinated? How do we help them manage their conditions? That investment is not paid for now in the healthcare system, but could have a huge impact on total cost of care.
What do you think about that's really interesting, but Chad said that healthcare, health insurance and healthcare really not a free market. And that's because, most of us aren't choosing our plans. I mean, actually the experience of the people in the marketplace is very different from people who get employer-based insurance, because I didn't pick my employer's insurance policy. It's just the one they offered me when they hired me.
You should form a union at the farm, because our union here at North Dakota United is involved in picking the plan.
Anyway. Thanks for that, Chad. So anyway, boy, you knocked me completely off. To me, it makes me, the situation that we're in with healthcare and health insurance makes me think of the situation we're in with utilities, where I don't pick my electricity provider. I don't pick my natural gas provider, right? They have a franchise and they're the one, and then I have to buy. And because of that, the Public Service Commission approves rates. And even in the insurance industry, Insurance Commissioner Godfread approves premium increases. And they have to come in and they have to make a case and they have to justify it. Are we at a point where we tell healthcare providers, you have to come in before a regulatory body and you have to justify your prices? Because I think we're at that point. And I mean, it gives me hives. I'd like to live in an Ayn Randian utopia where this could all be set in the free market, but that ship sailed a long time ago. People are being hurt by this. And we could talk about insurance all day, but all insurance is covering is the cost of the health care. That's the problem. And we're not doing anything to regulate that. I'm thinking maybe Sanford, Trinity Health, St. Elect, all of them. You have to come in and you have to justify your prices. Is that a solution worth looking at?
There are states that have done that. So their insurance commissioners have done a couple of things. One, they've said, we need a certain percent investment in primary care, just as a basis for approving rates. And the other thing they said is, we don't want to see a rate increase over blah. So you, insurance company, work it out with providers. I mean, those are, ongoing negotiation. But where is the downward cost pressure in the commercial market in other places. And so some states have done that. I will say other states too.
How does it work for them?
I think it's worked. I mean, it's, healthcare costs are higher than we want them to be kind of everywhere. And it's a little bit of a political decision too, because we're a really wealthy country. If we want to have really generous healthcare, we can, but then we just have to recognize low-income people cannot pay $20,000 a year for it. And so then we just need to resource it. But yeah, I think it has been effective in kind of bending that cost curve in states that have tried that. I think other states have also looked across the board and said, are there quality metrics that we want to have, statewide? For us as providers, we have different quality metrics for every single payer that we interact with, whether it's Blue Cross Blue Shield or the federal government or Medicaid. When is there going to be more alignment so that we can really orient our work towards improving quality, improving value, and reducing, high cost, avoidable hospitalizations?
No,
Well,
I think can I
I'm
just
sorry, go ahead.
make just one more comment on that? I think one of the things that you said earlier that is really spot on. The consumer isn't thinking about what the hospital is charging their insurance company. They're thinking about what their copay is, what their deductible is. That's why we need regulators that will come in, because I'm as a consumer, I'm still paying in my insurance rates what that hospital is charging my insurance company. So, I do think we need to figure out the regulation here, because consumers can't do this. And we've had people on the show before who've said, well, it's too complicated for consumers. Yeah, no kidding, it's too complicated. I think it's too complicated for most elected officials. It's too complicated for a lot of people working at hospitals. So just a final question. There's no answer to this, but it seems there's no incentive right now for healthcare providers and insurance companies to bring down costs because they're making money with the current system. Is there something that the state or the feds can do to force people to the table to say, this is not working? We need to bring people together to bring down prices. Or like Rob has said about the federal government, are healthcare providers and health insurance companies just too dysfunctional or they can't work? I mean, is there hope?
Yeah, I mean, I think there are a lot of incremental things we could do. And I think sometimes we get in our system in this like big bang, like, can we totally change everything? And like, I'm not totally against that. Like, I could get on board with some big changes. But I think what we don't do well is like with the marketplace. We passed the marketplace, but then it was so politically toxic. We just completely neglected it then for however many years. And so I think we really need to stick with it and figure out how we continue to incrementally improve the system. So, I think one of the big things that people talk about that isn't utilized very much in North Dakota is, we have a system that pays for volume. So the more services you provide, the more higher cost services you provide, the better you do. The more you can chase after those places where, ooh, we're making a lot of money on heart surgeries. How do we do more of that? How do we do more MRIs? Those are the incentives built into the system. And you can't hate on people for, trying to live, trying to make ends meet. But if you can start to change the incentives at a payer level to more focusing on value and outcomes, and are you making people healthier, I think those things could have a big impact in terms of both what our system is delivering in terms of high quality outcomes, but also the cost trend.
Well, Shelly, thanks for coming on. Shelly's the CEO, Community Healthcare Association of the Dakotas. They have clinics that provide primary medical, dental, behavioral health care to about 114,000 patients annually in North Dakota and South Dakota. Shelly, really appreciate you coming on. This is not a fun conversation to have, but we got to keep having
I do
it.
want to say our health centers also can help people who are trying to understand the marketplace. So
Okay.
it is open enrollment right now. Everyone should go and try to understand what their options are. But we also have in-person help. If you want to pick up the phone, call a health center. We have people who can help you make sense of your options.
Shelly, what's your website?
Get Covered North Dakota is where you can find a lot of that information, but communityhealthcare.net is our organizational website, and you can see where the map of where all the health centers are located.
Thanks, Shelly.
And Shelly.
Thank you, guys.
Hey, Plain Talk listeners, have something to say? Call or text Plain Talk with your questions, comments, or headlines you want us to cover.
Just dial 701-587-3141. Leave us your message or shoot us a text with your name and location, and you could be featured on an upcoming show.
Hi, my name is Ashley, and I am in Jamestown.
Hey, Rob and Chad. My name's Tony. I live in Grand Forks.
That's 701-587-3141.
Call us, text us, vent, praise.
We want you in the conversation. Thanks for being part of the show.
Now let's get back to today's episode.
Chad, that was another conversation about healthcare that I'm glad we had, but is also feels fruitless. And not for Shelly's fault at all. It just, everyone's doing the best they can, but it is so aggravating. And she made a point at the end about how, the politics around this become so toxic sometimes. And it's almost like the argument here is that like the number one solution might be to elect people on both sides who aren't children, who are maybe more mature and maybe a little more concerned about like good outcomes for voters and not, adhering to some specific ideology or just doing crowd pleasing red meat for the base.
The problem with that, Rob, is health insurance in healthcare is so personal, and it's so it means so much to individuals that it would be political malpractice for both sides and not to try to take advantage of it. You know what I'm saying? Like it's like Democrats are going to pound on this for the next 10 months, 11 months until the election, this affordability of health insurance. So I think I love when you get a little bit wishful and hopeful about what we could have, but I just think it's too good of an issue for both sides to not use politically, and that's why I love that conversation. It's a great conversation. I don't feel any better about that. We're gonna have a solution after it, though.
No, because the people who can implement it, I think, are incentivized more to keep the reality show drama going than to solve a problem, which might require some compromise and some admissions that some things we've said in the past are not correct on both sides.
Right. But one of the things Shelly said at the end, the idea is just sort of this big boom, we're going to explode and do something completely different. That might not be possible, but are there little incremental things? But those don't get you the political wins. And that's why I think your point of what can we do here in North Dakota to focus in on health insurance costs for people. It's a federal issue, but are there things we can do right here in our small community where people can come to the table? I think one of the things that she didn't say that made it like maybe we should be investing more money in these community health clinics around the state that do go upstream, that maybe don't have and are completely transparent, unlike the big systems.
Well, the thing about dental care, I think, is interesting. Stuff like that. I mean, that's just one case in point. But I think a big thing we could do here, I would like, and coupled with the price transparency, we've talked a lot about Representative Jared Hendricks's bill from earlier this year about price transparency that did not pass. I think coupled with that, make them come into the insurance commissioner and justify the prices.
Yeah,
I think those two coupled, better public access to what the prices are, coupled with you have to come in and make a very public justification for what you're charging.
And I think the point around the average consumer is just looking at their copay and their deductible. So somebody else has to look at the whole system, right? I mean, you and I as consumers, maybe we should be looking at what the healthcare provider.
Who has time?
Yeah, well, and it's complicated, and I think it's complicated on purpose to make consumers confused and not know who to blame and where to go to
keep them lost in a maze,
right?
Where they're never gonna find the fruit. All right, let's talk about bonuses at the Retirement Investment Office. Some more drama there. Now they went to the Emergency Commission, and then the Emergency Commission said, because there was kind of some drama about whether or not. I guess we should set this up of what this is. The Retirement Investment Office wants to pay what they're describing as performance bonuses to in-house investors. Now, this is something the state of North Dakota did, and I think it's a good thing, where instead of contracting with outside investment management, we hired some investment managers of our own to manage some of the RIO's investments. And by all accounts, they've done a good job, right? I mean, the outcome is good. They beat the market. They did really well. But now we want to pay out bonuses, and some of the people in the RIO office are in line for bonuses that double their salaries. And my objection, my problem with them is not so much the bonuses. I mean, these are a type of public employee that we've never really had before. I mean, it's kind of a unique situation. I'm not against the idea of paying them when they perform well and the state's investments perform well, carving off a small percentage of it. And in fairness, I think the $1.2 million in bonuses represent about 1% of the investment revenue. I think that's probably fair. The problem I have is that we're calling them performance bonuses, but the system they use to award the bonuses is heavily predicated on where you are on the org chart, which means the executive director of the RIO and the CIO of the RIO are in line for bonuses that could be up to 100% of their salaries. And then when you move down the chart to the people who are doing the work and doing the investments, they get not only have smaller salaries, but their bonuses are a smaller percentage of those salaries. I have a problem with this. Now, on top of that, there was some drama about whether or not the legislature had actually given them authorization to pay these bonuses. I guess they've decided that they do have the authorization now. They've gone to the Emergency Commission briefly, and then they pulled it back. And, I don't know. It's kind of a frustrating situation because on one hand, like, I don't want to get too over the top on this, but on the other hand, the way they're doing it kind of smells bad.
Yeah, so I'm fine with these bonuses as long as there's a salary take back when they don't do well, right? I mean, what happens in the years when the investors don't meet the benchmarks? Do they give some of their salary back? I mean, it doesn't seem fair that an investor invests taxpayer dollars and maybe they put in risky investments because it's a high upside and they don't have to worry about the downside, because they're still getting that base salary anyway. So I think if we're going to do bonuses, we should also do, if the performance is bad, what happens then?
Right. The bonuses are the carrot. What's the stick?
Right. So I would much rather them just pay much higher base salaries to everybody. And then if they don't meet the benchmarks, remove them, fire them. So increase the salary. Don't do this bonus thing. And if you're doing the bonus, you got to have the stick as well. I just think this is the way they do it in the private sector, maybe, but I think the governors in one of the articles said people don't stick around for bonuses; they stick around for really high base salaries. I agree with that. I think
that's right.
People more, and again, I don't like the bonuses. And the other thing that's been irritating me, Rob, is when I hear, it's not really taxpayer dollars. Well, you're using taxpayer dollars to invest this money. The earnings are taxpayer dollars, and more specifically, they're often retired teachers' dollars or retired public employees' dollars that are going into the pension system.
Well, along with what the taxpayers contributed as the state share of that compensation. So the thing is, here's the thing about that, because that drives me nuts too. Every dollar that belongs to the state of North Dakota, whatever its source, is a taxpayer dollar.
Right.
It all belongs to us. Now, we can have a debate about whether it should belong to us or whether we should cut a tax and let people keep it. We can have those debates. But when the state of North Dakota collects revenue from any source, it is a taxpayer dollar.
Right.
Full stop.
Yeah, the idea that you can invest $1 of taxpayer dollars and get back $1.50 and somehow that 50 cents is somebody else's money, and it doesn't make any sense.
And the thing I hate is it seems like every time we have a controversy over bonuses, it's always the top brass that are getting the biggest bonuses. Right. Every single flipping time. And it's not by accident. And that stinks. I'm sorry. It stinks.
And I think Jody Smith is great, and I'm really happy that she's in this job, and I hope she sticks around for a long time. But I'd feel much more comfortable just giving her additional $100,000 in salary than giving her a $250,000 bonus when the markets are good. And we should clarify, it's not just when the markets are good. They have to increase it over the benchmark, whatever that benchmark is. So when I first got these things, it's like, of course they had a good year. The markets are way up. I mean, I had a good year, and I don't know what the hell I'm doing.
Well, and how the benchmarks get set I know when I talked to our state treasurer, Thomas Beadle, who I have a ton of respect for, I think does a great job. He said they did bring in an outside entity to set the benchmarks, but there was some, he called it facilitation from at least a couple of people who are in line to get bonuses.
The lower
And-
the benchmark?
Right. Well, I mean, that's what you hear. So somebody who owns car dealerships or worked in the car dealership industry at one time got in touch with me and said, every time I would set up a bonus, my salespeople would always want to set the benchmarks as low as possible.
Yep.
Right. Because then when you exceed it, you have a bigger bonus. And, I think that's something. I think there could maybe be a little more transparency, a little more arm's length in that process as well. But again, if it's a performance bonus, it should have to do with your performance and not where you are on the org chart.
And again, if it's a performance bonus, there also needs to be a performance stick as well. Because I don't want, we had a good year, so they get $200,000. Then we have a terrible year next year, and they continue just to collect the same salary. It can't work that way.
Yeah.
It needs to be on both ends.
I don't want to throw the baby out with the bathwater. If we're going to bring investment in-house, this is part of the game that we have to embrace. I just think they could do some tweaks. But I mean, as usual, there's a little bit of criticism, and then people start digging in their heels, and then it becomes a thing.
Well, but
And
you
it
also
doesn't
have,
need to be a thing.
a lot of political stuff. You remember going to the last session, Bernie Satcham and others in Jamestown who were just up in arms about different investment things.
Yeah.
I think we're still seeing that with Mitch Oswald.
Well, yeah, I mean, a lot of it's coming from Jamestown, and the hot political rumor about that is the Bison World thing that they want the state to invest in, and the state was reticent to invest in it, and now they're upset about that, and there's this spotlight of scrutiny that they're putting on everything these investments do, and I feel like that has caused the people in the IRO to kind of turtle and bunker up, and they don't want to admit, maybe we could be doing this a little bit different, because that means it's like they're conceding that, I mean, it's politics, and it kind of sucks.
But I also agree that this isn't an emergency, so sending it to the emergency commission doesn't make any sense.
Well, and the emergency commission kicked it back. I mean, they took no action, and that was probably the appropriate thing. I'm still not entirely convinced that they have proper legislative authorization for the entire thing, and that's probably a slam on the legislature for being too vague, which they are prone to do. If this were to end up in the courts, I have a feeling that a lot of them wouldn't like what the courts have to say about the way they're doing this, but whatever, it's probably not going to go there. They could write the law better.
If bonuses are a thing, we need to have more scrutiny on the benchmarks to start out with, to make sure that they're high enough that they're not just, at some point, if the bonuses are too easy, then why not just put it in salary?
Right. And the thing is I don't want to throw the baby out with the bathwater, because I don't want to go back to where we have these investment fund managers who we have everything. Like, you sign up for some of them, everything is proprietary. The public's not allowed to know everything. We're dealing with Thread out of Grand Forks, which is a company that I think they got $5 million from the Wonder Fund. They got $15 million from, Badlands. It's an investment firm called Badlands, who, by the way, they manage some of the investments for North Dakota's growth fund. They got money from the federal government. Well, they now are being evicted in Grand Forks. Their website's defunct. I don't know that they've officially filed for bankruptcy or anything like that, but it sure ain't looking good when you can't pay your rent to keep your website online. And the thing is well, how many tax dollars were invested by Badlands? They control the growth fund. I don't think we're allowed to know.
Yeah, I remember when Doug Burgum was running for governor and talking about we need to get rid of the old boys network in Bismarck. I think he failed pretty miserably during his time.
Kind of feels like we just replaced it with a different set of old boys.
Maybe a younger set of boys that are getting the money. But I think your column that you had up, that we should have a database of these businesses who and how much money they're getting from different state programs, makes a hell of a lot of sense. Why shouldn't we know if some business who falls on its face, and again, we've talked a lot about, we're okay with trying some stuff, but we also aren't really doing a good job of figuring out the stuff.
There's so many funds
that's working.
There's so many funds, there's so many programs, and I just don't know. And both at the state and local level.
Yeah.
So, I mean,
Well,
I mean,
federal level as well. I mean, you said Thread
Right.
got some federal money.
there's probably not a lot we could do with, but if the federal money passes through state hands,
Yeah.
we could still put it in that. But I mean, at least we could get a complete picture of, did they get a property tax exemption? Are they in a TIF district? Did they get a sales tax exemption? Did they get an investment from a state program? We should be allowed to know these things, and there should be an easy place to go where you can look up a company name, or you can maybe look up a name of an officer. List all the officers for the company in the database. This is all information they have to report anyway. It's just a matter of collecting it in one place and publishing it. It's not that hard.
And frankly, the state should want this. I mean, right now, what we focus on is the Threads of the world, or other groups who have fallen on their face. We hear far less about the success stories. And I think that if there truly are success stories, we should know about them, because otherwise, I currently have the perception that we're just giving money to a bunch of people, sort of half-ass ideas, who are then wasting millions of dollars of taxpayer dollars.
We have scheduled coming up later this month, Representative Jonathan Worry and Representative Glenn Bosch are going to come on. Now, they both are on I think it's called the Legacy Fund Oversight Committee, and they're going to talk about some of the investments of the Legacy Fund that are really working well. Because I want to tell that side of the story too. I mean, it's a legitimate part of it. It can't be, it can't all just be airplane crashes. Sometimes the airplanes land safely too. So we need to talk about that. That's coming up. I do think your point's well made. I think that's an important part of the discussion. What else do we want to talk? Rick Becker is running for office, and I love it because I predicted
for Congress.
No, I said he was going to run for something.
I think we should go back. I think you said he's running for Congress.
Maybe.
Either way.
I mean, I may have thought Congress. I knew he wasn't on the bench, though. I knew he wasn't going to stay on the bench.
So, Rob, you didn't watch the big announcement on the Gary Emmons show? You weren't one of the dozen?
I was relying on you to relate to me what happened.
I was one of the
I did go back and watch it, though.
Okay.
At the time you were texting me, I wasn't tuned in, edge of my seat.
Yeah, I was one of the dozen, and one of my favorite parts was he started out by talking about how he's been on the ballot every single year. And
He's not
then
wrong.
I lost this one, then I lost this one, then I lost this one, and it's like, I'm not sure that's what I would lean into, being an unsuccess. And then he also leaned into how Donald Trump is worthless, and you can't trust the guy, and talk crap about Julie Fedorchak for quite a while, talk crap about the North Dakota legislature for quite a while, and then said, oh, by the way, I want to run for the legislature.
I think that Rick Becker getting back in, this is kind of my 30,000-foot view of what's happening. That faction of the Republican Party can't win on the statewide ballot because I don't think they represent a majority of North Dakotans. Where they have been able to win are in small district committee meetings. And so they've been able to capture leadership of the North Dakota Republican Party because, these low turnout district meetings, they do pretty well there. And they can win in some legislative districts. They've proven that. And so I think Becker, I think, still very much wants statewide relevance. He wants to be in the room where it happens.
Yep.
To quote Hamilton.
Yeah, how very Hamilton of you.
Yeah. And so he's never gonna win a statewide ballot. On the statewide ballot, Rick Becker's biggest problem is that a lot of North Dakotans know who Rick Becker is and don't like him.
What?
So where he can win is District 7. We're clear. Obviously, he's won before. He used to be the state rep there. And he wins there. Then I think you're going to see the Bastiats, the populists, whatever you want to call them. I think they're going to invest a lot in House races this year with an aim towards they get a majority in the House and then they elect one of their own majority leader. And I would say Becker would probably be at the top of that pack. And now all of a sudden, when it's the emergency commission or some of these other things that happen, the majority leaders of the Senate and the House are involved in a lot of that stuff.
And he gets to stick it to Kelly Armstrong every single day during election.
He gets to stick it to Kelly Armstrong, which this is. I think that's the strategy. I don't know if you agree with me or not. I think that's what's going on.
So as I was texting you during the announcement to a dozen of us, on the Beck show. I was convinced he's running for Congress, and during
I
leading.
had convinced myself that he was going to run for PSC, is what.
But when he announced that he's running for the legislature, I was like, oh, that's not very exciting. I hadn't thought about your perspective on this as sort of the path to be majority leader.
Right.
And I think that makes a lot of sense.
Well, it allows him to be essentially.
That's how you get in the room.
Well, it allows him to essentially be a statewide leader without having to get elected on the statewide ballot.
And if you're a traditional Republican, you better be looking at this and thinking, oh my,
Yeah.
we better get our crap together for June of 2026.
I don't think he's going to. Now, Becker hasn't made it clear whether he's going to run for House or Senate yet. I don't think he's going to run for Senate. Michelle Axman is there in District 7. She's running again.
But
in the House, though,
how much fun would that race be?
that race would be fantastic. Michelle Axman is no slouch when it comes to that. I will be honest. Rick Becker being on any ballot anywhere in North Dakota is good for business for me.
Right.
He makes a lot of copy.
Yeah.
But I don't think he's going to run for the Senate because in the House is the path of least resistance. First of all, they kind of already have a pretty good presence in the Senate, and I think Majority Leader Hogue is pretty pliant to their agenda at times. I think the House is where they're looking because Jason Doctor in District 7 is he hasn't made an official announcement, but he's not running again. I've heard that Matt Heilman may not run again, but I don't know. Again, there's been no official announcement. There's going to be at least one vacancy, so that's the path of least resistance in terms of running if you have an open seat. And then also, we don't know if Mike LaFleur is running again. And I don't know. He hasn't made an official announcement yet. What's been indicated to me is that he doesn't know yet. He hasn't made up his mind.
So a couple thoughts on all this is one, Brandon Pritchard's group going after Jason Doctor with the billboards and stuff. If that was part of this bigger strategy, I think I've not been giving them enough credit. Like if they were trying to push Doctor from running.
It's always hard to tell, like if it was it really strategy or did it just work out?
But the other thing, I think even if LaFleur runs, I mean, LaFleur's been challenged, I think, every time he's ran for majority leader. Does he have the votes if this June primary doesn't go the traditional Republicans' way? Like, it could be close.
They held the line, last cycle. Pritchard they tried. Yeah. And the normies held the line, but it was really close in some of those races.
They didn't gain anything. It was hold the line.
Yeah.
And so I think it's interesting. I think that, the Bastiats, I think they're losing some enthusiasm around the state. I also like losses sort of curtail some of the momentum, but I think Jared Hendricks has actually proven to be a more effective lawmaker than I would have ever guessed. We know he's an effective organizer. Can he organize 3, 4, 5 House seats?
He could, yeah. I think that's well within his capabilities.
Right.
And especially this struggle to hold the line is going to get harder as term limits begin to set in. Yeah. And you're going to have people who have a lot of name recognition, and that's what makes me worried about where the next generation of candidates is.
Well, and just really quick, going back to District 7, when Heilman, Doctor, and Retha Mathern ran 4 years ago in that primary, Heilman, I think, ended up being the highest vote getter. And so I think it's also going to be are there going to be traditional Republicans who run against Becker in that primary? And even if they do, I think it's a tough race for anybody to beat Becker in a primary. But I think that's the place to stop him. But I just don't know. I don't know what candidate would want to get into the mud with Rick Becker in a Republican primary.
Yeah. Brandon Pritchard lost in last year's primary because Mike Berg got in the mud with him. But that's what it takes. Candidate recruitment in this environment is tough because you're asking somebody to come out of the private sector, come out of their private lives and subject themselves to this. And the sad part is that is part of the strategy from that side, is to make everyone's lives miserable, to make people who aren't on their side in their little ideological campaign make life miserable for them, so they don't want to participate. And then they win because they're the only ones left.
Skip the conventions, go straight to the primary and win. That's the strategy.
All right. we're going to wrap it up there. Hey, coming up on the Friday show, we're going to have Ag Commissioner. Oh, sorry. Go ahead.
I want to mention one other thing, Rob.
Yeah.
You recently were honored by Chris Cicilla from the formerly the Washington.
I've never been able to pronounce his last name. He's a former CNN guy, a long time, like actually started as a blogger once upon a time.
Yeah, but like a nationally renowned political commentator mentioned you as somebody in North Dakota that folks should be paying attention to, and I think it's a well-earned recognition.
Well,
so kudos.
I appreciate that. He did. So what he did is he made a list of the top political reporters in all 50 states. Some states had more than one. I was the lone, I guess, designee in North Dakota. No, I don't think I deserve to be there alone. I think there's other reporters here that do really great. Or Grant Corsi at the Bismarck Tribune, I think, does a really good job covering the Capitol. April Baumgarten, I think, does. I mean, she doesn't do strictly kind of political stuff. She does a lot of crime stuff and that, but she's an excellent. There's a lot of excellent reporters working in North Dakota. But yes, I was very honored to be singled out that way. That was nice.
And let me just say, well earned, right? I think you're constantly putting out content that's relevant to what people are feeling and thinking. So, well earned recognition. So good for you.
Well, thank you, Chad. All right, we're going to go there. Ag Commissioner Doug Goring coming up on the Friday show. We're going to talk, recently the North Dakota Industrial Commission announced a loan program for farmers and ranchers in North Dakota because times are tough out there. We're going to have him on about that coming up on Friday. Remember to follow us on social media. We're Plain Talk ND on TikTok, Facebook, Twitter, all that. If you would subscribe to us on YouTube, by the way, we're doing really great there. We have some unique content, some additional bonus content sometimes on YouTube. That's really a great place to catch because you can listen to it, but you can also watch the video part of it if you enjoy that. So that's a lot of fun. Follow us on YouTube, subscribe everywhere, leave us ratings and review. Thank you so much for listening. We'll talk again. That's it for today on Plain Talk, the voice of North Dakota politics. Plain Talk is a production of Forum Communications Company. Got a question, comment, or suggestion? Leave us a voicemail or send us a text message at 701-587-3141. That's 701-587-3141. If you haven't subscribed to Plain Talk yet, you can find us on YouTube or your favorite podcast platform like Spotify or Apple Podcasts. For those of you who are already hooked, give us a rating or review. And don't forget to share or tell a friend. Special thanks to my co-host Chad Oban, and from myself and everyone at Plain Talk, thanks for listening. That stinks. I'm sorry. It stinks.